Hi.
Hi.
Hello, Elizabeth.
Hi.
Hi.
So good to see you all.
It's really good to see you too.
Likewise. Sue, hi.
Hi. We were just talking about how this feels like a club, you know, all getting sort of published at the same time and doing all these things together and supporting each other. It's really, I mean, it's been fun. It's
great. Let's make it a club. Let's like have meetups like every couple of months.
There you go.
I
I'd
would
love to.
that.
And then at some point it'll be called the post-pandemic book tour.
Right.
We'll
just go on forever.
Yeah.
We'll have a reunion in 10 years.
Well, you know, we have to keep selling. We've got to keep promoting, you know, especially after these first few months. And it's like a whole other thing to keep the book in people's minds. So
yeah.
Well, and let's
lots
write
to
a
talk
book,
about.
everybody, and we'll be a club. Let's keep writing.
Yeah, that's what I want to do. It's promotion takes a lot of work. I didn't realize. Yeah.
Oh yeah.
Yeah.
A lot of work.
Yeah.
But I am so grateful for all the opportunities, you know.
I am too. I mean, this has just been amazing. I mean, really stuff that is happening that actually absolutely would not have happened were not for the pandemic. Not that I am glad that we're having a pandemic, because I surely am not, but it's just interesting how the writing community has really come together.
Yeah, definitely.
Including, you know, the bookstores, you know, publishers, our fellow writers. I mean, just everything that goes into it, publicists, everybody sort of banding together. And it's just, I mean, it's been just sort of, you know, not to sound like a Hallmark card, but very heartwarming.
Yeah.
It has.
I mean, just been so supportive. So I guess we're ready.
Yeah, Madeline, you want to kick us off?
So, hello. Oh, my voice has gone really croaky now. Okay. Hi everyone, and welcome to the Writing About Mental Health panel. So I'm Madeline Dyer, and I'm joined by fellow authors Sue William Silverman, Erin Khar, Elizabeth Kadetsky, DJ Lee, Laura Zam, Jodie Skillicorn, Myer, and Jodie Skillicorn. We are a mixture of memoirists, personal essay writers, creative nonfiction writers, novelists, self-help writers, and poets. So we write quite a lot between us, and we'll be talking for the next hour about mental health in our recent books, why it's important to have accurate mental health representation in books, and why we chose to write about mental health. So yeah, we'll start with introductions. So I write YA fiction predominantly, but I've also got experience within personal essays and poetry. This is my poetry collection here. It's called Captive, and it's based on the therapy writings I produced when I was suffering from extreme OCD and psychosis due to brain inflammation. So next, Sue, do you want to go ahead and introduce yourself?
Sure. So I'm Sue William Silverman, and this is my new book, How to Survive Death and Other Inconveniences. And this is actually my fourth memoir. So clearly I have a lot of mental health issues. But in this book, I do explore my fear of death and also trying to discover what the origin of the fear is. And one of the origins I came to learn was a sexual assault that I experienced. And the aftermath of that was a sexual addiction, an eating disorder, anorexia, as well as this profound feeling as if my body had been stolen from me, that I'd really lost it. And all of that really did feel like a form of death. So that is one of the things that I explore in my book.
Yeah, I really like your book because like I have already read it, and we've done a few events.
Beautiful.
I'm really familiar with that, with your essay collection. So I'm excited to learn a bit more about it. So Erin, do you want to go next for introductions?
Sure. I'm Erin Khar. I'm the author of Strung Out, One Last Hit and Other Lies That Nearly Killed Me. This is my debut memoir. The book covers obviously a lot about my long addiction, which spanned the course of 15 years and started at age 13. And at the root of my addiction, there were a lot of mental health issues stemming from also like early childhood trauma, which was sexual abuse. And so there was PTSD, personality disorder, depression, anxiety, all of those fun things that are often present together when someone is struggling. So it's not something that I've shied away from writing about before. I've written about mental health and addiction in my personal essays, in my weekly advice column, Ask Erin, and even in short stories. I'm excited to be here and chat with everyone.
Yeah, it's great to have you here, and I'm interested to ask you a bit more later on about your short stories as well and how you incorporate mental health in so many different genres and forms. So yeah, we'll definitely come back to that. Elizabeth, would you like to go next?
Sure. Hi, everyone. This is my book. It's called The Memory Eaters. It came out at the end of March this year, and that's a picture of my mother on the cover. So my book is an exploration of memory, forgetting, Alzheimer's, nostalgia, addiction, homelessness, all set in the context of the heady days of New York City in the late 1970s and early 80s when I was growing up. And it started out as writing about my mother's Alzheimer's as it was progressing and as my sister, who was suffering from addiction, was caretaking her. And I found that I was using nostalgia as an escape. And so the book is nonlinear. It's interlinked essays, and the essays move from the past to the present, the past as a kind of balm and salve for dealing with the problems in the present. And from a mental health angle, it very much deals with trauma, traumatic memory. So what Sue was saying just now really struck a chord as well. Dissociation used in many different forms by the three central characters in the book, myself, my mother, and my sister, in different ways. And in some ways, nostalgia, even as a kind of dissociation. And addiction and depression are strong themes in the book. So I'm really glad to be here and be connected with these other great authors, also looking at these topics in really different ways.
Yeah, it's great to have you here, and I haven't read your book yet, but it's like on my next to read list. So I'm really looking forward to looking at it, because like I do like books about nostalgia as well, and like with it being a memoir, it's obviously so personal, and yeah, I'm just really looking forward to reading it. So DJ, do you want to go next?
Yeah, my book is called Remote. I did not know I'd be releasing it remotely when I titled it. Finding Home in the Bitterroots. It's my search for my grandparents and a friend who went missing in the Selway Bitterroot wilderness of Idaho and Montana, which is part of a roadless complex that's over 5 million acres with 0 roads, 0 access except for on foot by bush plane and mule and horse. So my grandmother, my search, literally goes into this wild land. It also looks at who my grandparents were, and through that process of searching, I found out that my grandmother was in a mental institution for a great part of her early adult life. The book has, each chapter has a black and white photo. So this is a picture of one of the institutions that she was in the 1940s. And it also, obviously, like Elizabeth and Erin and Sue were saying, it also explores my own struggles with depression and that family lineage that I somehow have inherited. So yeah,
That sounds really powerful.
Yeah.
Yeah, Laura, do you want to go next?
Sure. My book is called The Pleasure Plan: One Woman's Search for Sexual Healing. And my book it's a memoir, it's a sexual healing guide, and it's a love story all mixed up together. Right after getting married in my 40s, I acknowledged that I had 6 different kinds of sexual dysfunction associated with childhood sexual abuse. And to save my marriage, but also find pleasure for the first time in my life, I decided to reclaim my body. I'm resonating with what so many of you are saying. And so this journey took me on this very bizarre adventure where I saw 15 different kinds of practitioners, and I tried 30 different healing and pleasure enhancing modalities. And many of those people that I saw were mental health professionals that I was trying to have help me with my sex problems. And they were, for the most part, pretty clueless. And I realized doing this, I really delved into not just the advice that I was getting, good and bad, but also the training that mental health professionals and medical professionals get and don't get when it comes to women's health. And so my book then became really a mission to talk about these issues and what these professions might do better to help us and how we can empower ourselves.
Yeah, like I have actually just finished reading your book, so I was really interested in sort of how you look at gender and mental health and different treatments of like different genders by mental health professionals. So I think that's something we'll definitely come back to later on in this panel. Jill, would you like to introduce yourself next?
Yes, I wrote this book, One Pill Makes You Stronger. It's basically started as a kind of pursuit of, after my husband's death, he took his life while he was on the drug prednisone. And it's sort of details both of our stories going through his psychosis first on the drug and the reaction of the of his doctors who did not prescribe anything or did not treat it seriously. And it progressed to depression and the taking of his life by suicide. And when I started writing it, I was told that it was too soon. I couldn't write anything else though. Right after that, I'd done fiction writing, I'd published short stories variously. And I decided that I just had to pursue it. And I was told that, maybe it was too soon, that my story was too gritty, it was too raw. And I thought, well, this is what I have to do right now. And like Sue goes back, I read her memoir and other memoirs that she's written, and she goes back and looks at things differently through different lenses. And I thought, well, maybe that's what will happen with me eventually. But right now, that's what I had to do. I know that Madeline, you wrote poetry, and that's a really good form for first discovering what's going on with yourself. And anyway, what happened was, as I started writing it, I realized it was definitely not cathartic. I wasn't really necessarily healing myself, but I wasn't finding any help in, like Laura was discussing, with psychiatrists, with psychologists. And it was a kind of a process of discovery. And it turned almost into kind of an advocacy book. And that's what's kind of helped me.
Yeah, it sounds like it was like important for you to write in that respect, like therapy in a way. But yeah, I'm sorry for your loss. So
thank you.
So next will be introductions. Caitlin, do you want to go next?
Yeah. So my book is called Wiving, Memoir of Loving Then Leaving the Patriarchy. It's my debut memoir, and it explores the intersection of gender, religion, sexual trauma, and mental illness. My mother was bipolar and died of kidney failure from far too many medications for far too long. And while I was in the process of writing the book, I was diagnosed bipolar as well. So strangely worked out. But like Erin, I came from a fiction background, so I wrote a lot of short stories as well, dealing with mental illness. And then I slowly began writing essays, and finally, a few people talked me into writing a memoir. So here we are.
Yeah, I can't wait to read your memoir. So yeah, it seems to cover so many different topics as well, which I really love about memoir, because like on the surface it could look like it's just about one thing, but then our lives aren't like looking at things in isolation, like everything sort of like weaves together, and that's one of the things I really appreciate about memoirs. So yeah, Jodie, do you want to introduce yourself as well?
Yeah, sure. So I'm Jodie Skillicorn. I'm a holistic psychiatrist, and my book's nonfiction. So it's Healing Depression Without Medications, Balancing, or a Psychiatrist's Guide to Balancing Mind, Body, and Soul. And so my book is sort of divided into two parts. And the first part sort of debunks a lot of the myths around mental illness, and challenges sort of the idea of a neurochemical imbalance, and proposes instead, based on the research, that really more of it's stress and inflammation. And as I listen to all of you talking, so much of it's related to trauma and related to medical illness and related to medications that can lead to depression. And anyway, it's just there's so many etiologies, and these are not really talked about. It's sort of a one size fits all for most. That's what we're taught in medical school. And then the second part offers just alternative means of treating depression beyond just medications. So.
Okay.
If I might just jump in a little bit there, I think it's always been my feeling that this idea of dividing mind and body has not been very helpful.
No.
Historically.
Yeah, absolutely not. Yeah.
Yeah, so yeah, I'm really sort of like interested in your opinion, like as a psychiatrist, on like several other topics that we've got planned for this panel. So it's always interesting to get sort of like a medical professional's view as well, especially when we're all talking about like really personal things that we've experienced. So yeah, getting different viewpoints is always like really helpful. So yeah, we've already talked a bit about this, about why we decided to write about mental health in the first place. So if we just go into that in a bit more detail and a bit more depth, I think. So DJ, would you like to start us off here and tell us a bit more about why you started writing about mental health and what motivated you to?
Well, I think, like I said, I suffered from depression for a big chunk of my life, and I have a daughter who's now 30, and my mother suffered from it, and obviously my grandmother did, which I did not know that much about. So I felt like in exploring her experience, I was trying to find a way for the family to heal. I mean, I didn't think of it that way, but that's sort of how it turned out. I also, in my book, get into epigenetics a little bit, and how trauma can be passed down through ancestors that we may never know, like thousands of years ago, something may have happened and it's passed down through the DNA. And I do think that one way of I've done a little bit of like constellation work and those kinds of alternative therapies, and one way to heal that wound, whatever it is that causes these disorders, is to write, is story work, is to retell a narrative for a lineage. But I'm also interested, in writing about mental health, am interested in like the neurodiversity paradigm, and how these altered moods, or these, non-normative moods, might be brought into the mainstream as just a different neurological cycle that people go through, so that they're not pathologized as much. So those are some of the topics that I think about in my book and in writing my book. But I also felt like, because my grandmother's illness was, for me, located in this landscape, I had to explore the psychogeography of this wild land in order to understand the quote unquote wildness of her mind. To bring some clarity to my own situation and possibly my daughters, and the lineages that go up and that go backwards in time.
Yeah, what you're saying about like trauma being inherited and like in DNA. I find that really interesting. So Jodie, do you have any sort of like views on that, like from like a more medical perspective?
Yeah, so well, one, I just love that term psychogeography. That's such a beautiful word, and I think that's the thing that's missed with psychiatry and really medicine in general is we don't look at the whole person, right? It's all we sort of see it through this really myopic lens of, so if it's a mental illness, then it's, you know, neurochemical imbalance and there's genetic flaw, and we fail to take it into context, right? And so as I'm listening to all you talk, right, it's all context. And so I love, as DJ was saying, the intergenerational component, right? I mean, that's such a huge piece. And epigenetics is really the name, is really what all the research is suggesting. And what I love about that is the hope of it, because if we can, we can shift our epigenetics, if it was shifted in the past because of trauma or because of really trauma is what shifts it, then we can reshift it, right? Medicine still is under this old paradigm where the brain is static. And so when people come in and they get diagnosed with mental illness, the idea is once broken, forever broken. And yet that's so not what science tells us about neuroplasticity and about the capacity of the brain to change. What science tells us is that with every thought and with every action and even every bite of food we eat and every time we exercise or don't exercise, every time we take these choices, we're shifting the wiring in our brain. And it often appears static because we keep sending the same messages, right? It's actually said like 85% of our thoughts are repetitive. And so much of it's just kind of this repetition. And so we keep sending the same messages and the same signals and the same stories even of what mental illness is. And that influences how we experience it and how it progresses and the outcomes. And so, yes, I think the real work is to realize that we have the power to change our brains regardless of what's gone. We have a tremendous capacity to do so. And that really these labels are very limited. And they, I think they really limit possibilities for healing.
This idea of story is very much an obsession of mine, and how the stories that we tell, this idea of, oh, we're going along and everybody's fine until something happens, until you know, Cinderella goes to the ball or whatever. There's an inciting incident, but if we can, like you talk about, transform the story, we can transform ourselves, presumably.
Yeah.
Yeah, so a lot of like writing about mental health does seem to be sort of like we need to do it in order to understand ourselves more, but also like it does raise awareness as well for mental health conditions the more they're written about. So Jill, I know you've already said like about why you started writing your book. Have you written anything before then about mental health, or was this like the first time you actively sort of started writing about mental health?
Excuse me, I think it had come out in some of my stories, not to this degree. It was kind of more of a undercurrent of some of the main characters. I think that this incident was what really propelled me to start looking and researching, especially dealing with my depression after my husband's death, and then finding out more about his family, and that he probably did have a latent predisposition I'm sorry, I feel I don't know this terminology really well, toward bipolar disorder, and it was exacerbated by the drug prednisone. When they took the background history of him, he had suicide in the family, he had other mental health conditions in the family that they just sort of disregarded, or they just they didn't take really seriously enough. They were more concerned with treating his illness, which, they were right on top of that. And prednisone really was the only drug that they could use at the time. It's just that they looked at the physical aspects of it as opposed to the mental aspects. They just really downplayed that. And so I would say that it was the only thing I could write about. And prior to that, I hadn't really thought about it that much. I knew that I felt a lot better when I wrote. When I started writing, I really felt like I was learning about myself. And there had been some depression that I experienced. I'm not sure that it ran in my family, or I never really followed through with that. There aren't enough of my family members left living that I can really, research. But I think that the discovering about myself was what really affected me when I started writing my book. And it's followed through to now. My interest now is to continue pursuing that in a creative nonfiction level. And it's just so exciting to see the different forms that memoir can take now. You with your poetry, Madeline, and Sue with poetry and the lyricism, and Elizabeth too. I haven't been able to read the rest of you. Some of you, your books aren't out yet, so I won't get a chance to do that. And you can kind of inculcate so many aspects of fiction into memoir and various other genres. So that's very exciting.
Yeah, definitely. So Erin, you were saying that obviously your memoir is very personal to you and it's based on your own experiences. So what was it that made you actually want to write all of this down? And was that the first time that you'd written about mental health in that way, or was it something?
No, I started with my advice column was the first place that I really started using my own personal experiences to speak to people about mental health, and then more so in personal essays and in short stories. With the memoir, it was twofold. It was a story that I felt like I had an opportunity to share something that in a narrative form and present addiction in a way that people may not have thought of it before, because I didn't, during the years that I was using, I didn't look like what people's idea of an addict looked like. And I was a heroin addict who started at age 13. A huge part of the reason that people don't get help for things like addiction and mental health issues is the shame and stigma surrounding them. Shame is something that keeps us locked in, repetitive behaviors for a really, really long time. And I think that, as Jodie said, there's not a one size fits all solution for addiction or for mental health issues. That said, I think that, there were a lot of there was so much shame that I had around confronting my mental health issues that when, after 10 years of hiding my addiction, it came out and I went to rehab for the first time, it then became about clinging to the story of me as heroin addict rather than to the story of me with borderline personality disorder or severe depression or suicidal ideation. And I was so afraid of being labeled and so afraid of the need for psychiatry and for the stigma attached to that I really didn't allow myself the opportunity to get the kind of treatment that I needed. And for me, that did end up being a medication that helped me greatly. And I don't think that I would be sitting here right now, because even after I was able to stay off of drugs, and it's been 17 years for me, I was still not functioning in the way that an adult should function. I was still having a lot of trouble regulating my emotions. And I think that for a lot of us, it's a combination of factors. I think that there is often a neurochemical imbalance, and then there is situational things like childhood trauma, whatever the series of events, and then there are the belief systems that we create about ourselves, right, that happen at a very early age, and we often subconsciously continue to act out scenarios which reinforce those belief systems. So for me, I had a belief system about myself that I was, if people could see who I was on the inside, I wasn't lovable. right? I was a monster, I wasn't lovable. And I think that that's a primal fear for a lot of people, this idea that they are not worthy of love if you go underneath all of the layers of what's on the outside. So I continually acted out in ways that proved that belief system I had about myself. So this is my very long-winded way of saying that I wrote the memoir because it was the book that I had needed when I was younger. The thing that's made me happiest in sort of reader response is how many people who've never had addiction problems or been that close to anyone with addiction problems has been able to look at it with a different lens because they were surprised at how much they related to in the book. And that is exactly what I wanted it to accomplish. I think that the more that we talk about these things, the more that we write about them, the greater chances we have of destigmatizing them and lessening that shame for people, because it's really the shame that keeps people locked in. And, you know, I'm interested, whether it's through memoir or the advice column, essays, short stories, I'm interested in constantly breaking that down.
Yeah, definitely. So like it is important just to keep talking about mental health and try and remove some of the stigma. I know when because my mental health experiences have been caused by an autoimmune disorder. It's autoimmune basal ganglia encephalitis. So antibodies attack my brain, and the region of my brain that gets most inflamed by it is the basal ganglia, which is responsible for like habit formation and emotion. So when my brain is really inflamed, I get severe obsessive compulsive disorder and emotional lability. So yeah, it is like I was really worried about telling people that I had OCD just because there's so much misinformation about what it is, because a lot of people do use OCD just as an adjective to mean like wanting something like neat or that they like things to be tidy. Because you always like hear people say, oh, I'm so OCD about this, but it does really trivialize the mental illness, because like it is a severe anxiety disorder. And I also experienced psychosis due to my brain inflammation, and I was particularly felt quite ashamed by that because of the stigma around it. And like often in sort of like movies, particularly like older movies, you'll see like psychosis is used as a plot device or as an extra way to make the villain like extra evil. And it's like this fear around mental health. And like when I started writing my poetry collection, I didn't even realize I was actually writing it, because it's all made up of the therapy poems that I wrote when I was dealing with like all this that was going on. Because a side effect of the brain inflammation I also had was I couldn't communicate verbally very easily. So I really turned to like writing and poetry. But because like I'm usually a YA fiction writer, and I couldn't write prose anymore. So poetry became really important to me. And it really helped me sort of discover and understand my experiences more. And yeah, I think writing about your own mental health is just so important. And it was a relief for me to be able to write everything down that I was struggling to understand and process. And yeah, although I was using poetry, which is a form that does provide some distance, and I think I did use that distance to almost distance myself from my mental health in a way, so that I could examine it in a more abstract way. But yeah, writing about my mental health was fundamental for my therapy, as I then was able to understand my illness better and sort of like get a better perspective over it.
Yeah, I think that when I was writing, you know, essays and things earlier on, I think that was definitely part of it for me. With the memoir, it was a little bit of a different process because I had so much time and space between me and the events. You know, when I wrote this, I had 15 years between myself and the events, and the course of my addiction was 15 years long, and now I have 17 years. So I have more time away from it than I was in sort of like my years of active addiction. So I think that having, for this particular book, having the space that I needed was a completely different process than when I was closer to the events. And it's interesting because I think I would have written a different book. You know, it would have been a different, there would have been a different narrator.
Okay, so yeah, Laura and Sue, I'm interested to hear your thoughts on all this and about the processes of writing your memoirs, and whether you feel it helped you understand mental health better. So do you want to go first, Laura?
Sure. Well, listening to you all, I'm having this whole insight about my journey. independent of the book, actually, or concurrent with the book for one half. So I'm just now realizing I actually had two mental health journeys. The first one was based in story. I went into therapy when I was in my late 20s, and I spent 20 years talking about my abuse, talking about epigenetics. My mother was a Holocaust survivor. Much of what I talked about was an intersection of my trauma and my mother's trauma, and also all these overlays of just family dynamics and dysfunctions and things, and how that trauma was exacerbated. And it was all psychological and emotional and narrative. And I felt that I made tremendous progress. I felt like I made really tremendous progress. I almost never, ever talked about my sex problems. They seemed absolutely irrelevant, because I was talking about all of these emotions and whether or not I was furious at the men who would abuse me, and these sorts of things, and the fact that I had painful sex, or that I didn't have a libido, just seemed like, well, inevitable, because I thought, well, I've been abused, I'm broken in that way, and that's just the way it is. And it wasn't until I went on this journey that became my book that I realized I needed a completely different mental health journey that really was about my body talking. Because in the first half of my journey, I did not have PTSD. I didn't have any of the symptoms. But in the second half of the journey, when it was just about my body and the response, the effect of the abuse, I did have PTSD, but it wasn't what's in the DSM. I had vaginismus, for instance, hypertonic or overly tight and weak pelvic floor muscles that made penetration difficult and even impossible at the beginning. That's what I call in the book PTSD of the vagina. My body retained this in a way that that was pre-narrative, which is, I was abused really young, and so my body just said no in ways that my mind couldn't really process. My whole body's really a minefield. And so I really had to go in and just literally have those parts of the body speak and reveal to me, okay, what the heck is going on? And it was fascinating, and I got very interested in the way that it's not just my life where these kinds of effects are missed, let's say, in a therapeutic process, missed by the patient or client and missed by the provider. I started meeting other people as well that had so much help, so much support, and yet they really couldn't get beyond certain points in terms of their own sexual healing or finding some kind of healing. So anyway, I just got really interested in all of these different aspects of healing that, and especially the narrative, which I love as a storyteller, and the non-narrative.
Yeah, Sue, do you want to sort of elaborate on that, or?
Sure. Yeah. So I wrote my first memoir is Because I Remember Terror, Father, I Remember You. And it's about growing up in an incestuous family. And I really wrote that at the urging of my therapist. Before that, I'd been writing really bad fiction. I mean, I just can't write fiction, but I was too scared to tell my real true story. And so my therapist encouraged me to do that. And I did, and the world continued to turn, and that was great. But the second book is Lovesick, which is about 28 days I spent in rehab with a sex addiction. And I had much, much more shame about writing about sex addiction than about incest. But again, I just felt like, I had to do it. And so that was my second book. And then the third is the Pat Boone Fan Club, My Life as a White Anglo-Saxon Jew, which is a very kind of quirky search for spirituality. And then, writers write their obsessions. So one of my big obsessions also is death, and that's what brought me to my fourth memoir. And as much as therapy really helped me a lot, I think that the writing brought me to a much deeper understanding of the experience in that, so writing a memoir, yes, we tell the story of what happened, like this happened to me, and then this next thing happened. But a much more important part is that reflective voice that can look back at an experience and, kind of make sense of it, sort of discovering the metaphors of the experience. You know, Writing memoir is not like just Xeroxing a life. It's really turning your life into art. And so it's a very rigorous self-examination, which I just would not have had, you know, just with therapy. I mean, life is messy, therapy is messy, but writing or creating art is not messy. It's really, it's what gives an organization to your life. So, it's sort of like once I write a book or once it's like you can hold it in your hands and sort of out there and you can see and understand the whole of it. And so it gives that sort of context and organization of, kind of what happened so that you can see and understand what did happen to you in a very profound way. So that's what writing memoir really has done for me is just, again, therapy totally, helped me save my life. I wouldn't be here without this therapist who finally understood that, I wasn't just depressed, I had a sex addiction. And as much as I just want to take a pill to get rid of it, there's no pill for sex addiction. You just have to stop the behavior. So, I'm very grateful to my therapist, but it is a very messy sort of process, a lot of, sobbing and, anger and rage all free floating around in his office. But then writing is just giving that real focus and organization. And as I say, discovering the metaphors of the experience so that I could go just much deeper inside all of these different things that had happened to me and make sense of them.
Yeah, so discovery does seem to be sort of like this huge thing that we're all getting from writing about mental health.
Yeah, self-discovery. Yes, not just like, okay, this happened to me. It's just going inside of what that thing is that happened to you.
Yeah. So Elizabeth, when you were writing the Memoir Eaters, did you have a similar experience of discovery and understanding mental health more through writing it?
Absolutely. And all these insights are just so great. I would really think that everybody on the panel is a therapist in their own right, given the sophistication of this discussion. It's just amazing. So yeah, a couple of things. Because the memoir is in essays, I kind of picked and choose which elements to add. And in the end, when I was organizing the book, I decided to make sure that each essay had a kind of lens. So Sue was also talking about that earlier, looking at different experiences, the same experiences through different lenses or the same overall narrative. So the lenses wound up being epigenetics, trauma therapy, nostalgia, and yoga, a couple of different specific concepts from yoga. But one of the essays I wasn't sure about adding that I did add in the end is about an assault that I was a victim of a couple of years before I started writing the book. And I went through exposure. I went through several therapies. So the essay is about the different therapies and the PTSD that I suffered and the experience of dissociation in many forms that I experienced while recovering. But the therapy that wound up being most effective for me was exposure therapy, which kind of ties into what I think DJ was talking about, where you tell the story. It's basically doing story work. So I had to sit with a therapist. It's considered a very unpleasant therapy and it's not very popular, but you basically sit with a therapist and you narrate what happened and you keep telling the story over and over. And then once you get really good at that, and you make a tape of it and you listen to the tape. And then once you get good at that or comfortable with it, so it's about habituating yourself to the story. Then you go back to the place where the encounter happened. You put yourself in the way of some of the people who might have been involved in the event or the aftermath of the event. And it's all about creating a narrative that changes the way that you think about it and creating a kind of rational structure for something that the mind and body reacted to in a completely non-verbal, non-linear way. So I was just so interested in a lot of the stories I heard right now, which really connected with that. But anyway, my book was really more about my mother's Alzheimer's and my nostalgia. So I kept thinking, well, this doesn't fit. This essay doesn't fit in. This is about something else. But then at a certain point, it kind of clicked because I realized that even though I had all of these different lenses, what the book was really about was traumatic dissociation and how my mother, my whole life had seemed traumatized. And the book partly is a journey, a quest that I go on to find out why. And why it was that when she was diagnosed with Alzheimer's, it seemed almost a kind of natural progression of this quality of absence that she'd had my whole life. And so I went and did a lot of research into her past, and her mother, my grandmother, had been an alcoholic, which I knew. But that's where the epigenetics angle came in, where I see that there was this pattern of inherited trauma and that my mother had taken on a huge amount of this trauma because of specific events. So I kind of uncover the trauma, which turned out to be a family secret that hadn't been spoken. And I speak it in the book, which to me was a way of releasing it. But it was also a way for me to understand how I had inherited my mother's patterns of dissociation, so that when I was assaulted, right where I went was to dissociation and other difficult experiences in my life and depression in my past. Dissociation had always been my go-to. So in writing the book, I was able to see dissociation and trauma as really the linchpin for the whole thing, what was going on with my mother, why I related so much to the story of her trauma in the past, and then also my sister's story of addiction and subsequent homelessness and her own mental health issues. So I wouldn't have put all that together. And if I had written a more narrative, a more chronological book, I think I would have really missed that. And I probably would have left that assault out, but putting that assault in kind of just brought it all together.
Yeah, and like I guess that's the thing about memoir, that it can encompass so many different things, and like you can find sort of common threads and so many different things that you might not necessarily realize are related at first, like, but once you do start like diving deeper and discovering it more, you do get like a bigger sense of understanding between how everything could be connected, and you start to see all these links.
And I think like even in therapy, I've had therapists say to me, oh, don't worry, you forgot what you were going to bring up. It always comes back. The same stories always come back. So I think in a memoir too, you start to see things as repeating, but they're repeating because of the lens that you're bringing to it, and the themes are what are repeating.
Yeah. Mm-hmm. So
yeah, I like that. I love that idea, Elizabeth, that about when you're writing sort of a memoir in essay form, that sort of just turning the lens slightly as you move sort of from essay to essay, you're still connecting to that common theme, but it's sort of approaching that from different angles. So I really related to what you said about that's really fascinating.
Well, and then also that great theory of parallax. So there's that sailor's expression that if you want to see something, you can't look directly at it.
Exactly.
Yeah. And I think that a lot of epiphanies and kind of eureka moments come that way too. So changing the lens can help you, because you're not looking right at it, and then you can see something.
Tell it slant.
I think it took me so long to write my book, like 15 years. And part of it was I was trying to write it chronologically for so many years. And finally I just said, and it weaves back and forth in time, but trying to find those, the places where two things that don't seem to go together actually do go together, and what that, in the Venn diagram, what that intersection reveals about both of them was really exciting when I finally let myself go there as a writer.
Absolutely.
I love what you're all saying about how the writing itself really forces you to think about it through different lens, but also what the structure of this is, if it's going to be linear, and just putting it in your mind in that way all of a sudden lines up these events differently, makes you, for me, it gave me hope and it gave me courage to explore my body because I had so much shame. But when I I put things first into a one-person play because I thought I'm not going to be able to heal. I'm not going to be able to approach these issues unless I'm writing about it. I won't have the bravery, and I won't have any ideas how to come out of my stuckness. So I just so relate to you guys and what you're saying.
As I'm listening to all of you, I'm also struck as a therapist how and I've known this, but listening is becoming really clear, right? How therapy is so much like writing. Writing is therapy for all of, right? But it's also a reflection of what therapy is, right? Tying in all the different contexts, looking at things different lens. Like you were saying, Elizabeth, right? It's going to come up again. It keeps coming up in different forms, in different scenarios, in different, and so you're not going to miss it. It's going to keep showing up. But not only that, but not only the story, but I think, Laura, you were talking about in the body, right? The body is a metaphor for what's happening in our lives. And so for you, is expressed sort of sexually, but it can be expressed in any part of the body. And so it's all these things are tied together. And that's what's so beautiful about writing and memoirs, right? It allows all these things to be tied together. Whereas, you go see a doctor and it's all very broken up into pieces and parts, and it makes it impossible really to heal because there's so many different facets and parts that get ignored and overlooked. So
I'm actually going to, I have, my own experience was very different. If I was looking for therapy, I would not have written a book to do it.
Yeah.
It was for me, writing a book for publication required an absolute rigor, and I had to be unsparing with myself in a way that in therapy is probably not the most helpful way to approach things. So I am glad, as one friend told me, you will be glad to have written it. And I did get to that point, but I wasn't writing it for my own therapy. I was writing it for other people, for people who needed to understand how to get through shame, like you've been talking about, how to bring together all of these disparate things and change the frame of a story and find ways out of their repetitive stories. So that's just one slightly dissenting voice.
I have a similar feeling about it where as I had mentioned earlier, like I personally couldn't have written my book had I been closer to the events. I needed that. I had already done sort of like the therapy and the work before I sat down to write this. And I think it's amazing if you can write a book as you're working through that in real time. I couldn't have done it. I would never have been able to be as objective as, my book does move chronologically, but I have two sort of voices in each chapter. It's the voice of the person I was at that age, and then there's the voice of me today, who's able to add some insight and to have some distance from events to give a perspective that I wouldn't have had 15 years ago. And so I think that's, one thing that comes up constantly in interviews about writing memoirs. Oh, this must have been so cathartic for you. And it's like, no, the catharsis happened before I wrote this, or I wouldn't have been able to write it. That's just for me personally. I had to have already done the work to then get to a place where I could take the story and create a narrative arc out of it with some objectivity. And as you mentioned, Caitlin, like I had to be willing to be unlikable as a character in the book. I was very conscious of trying to show myself as honestly and plainly as possible, and keeping the story focused on my lens so that I wasn't telling anybody else's story. I was telling anything that was told about anyone was still through my lens, right? And that's so tricky to do. And I think that I know that for many of us, like when we're writing about other people, I was thinking about Elizabeth does such an excellent job of being able to write about these other people, but it's still through her lens. And I think that's so hard to do, but I wouldn't have been able to do it had I not had that time and space. But I, certainly 100%, as you're going through things, just the act of writing and recording is very therapeutic. I was able to write in such detail in my book because I had kept journals from the age of 7, and I recorded actual conversations, like he said, and then I said, and then he said, with like quotation marks and dialogue back and forth. That was a gift to me when I sat down to write the book. So I think that, and I think that with other forms, like I know when you were talking about poetry, I think that you may be able to have more of a sort of cathartic experience or therapeutic experience in finding as you're drafting and finding your way through that sort of lyricism. Certainly, like I've experienced that, but not as much in sort of like this straightforward memoir.
Yeah, definitely. Like, aside from my poetry, I'm working on a full-length memoir about like my experiences as well, which tell it all chronologically. But because I've still got brain inflammation at the moment and I'm still like undergoing treatment for it, I found that whenever I have tried to write my memoir, I haven't sort of been able to do it in like a way that feels right. And it's very much, I think, because the story that I'm going to be telling in it is still a story that I'm currently living now. And I need that space and distance because I need to know sort of like how it will end and at what point the story will end, and I will stop writing the memoir, because then I'll know like the whole shape of the manuscript as well. But I do think I need that distance as well in order to process it more. So yeah, there's definitely a difference between how I wrote my poetry collection, because that was very much just a therapy writings, and it wasn't until about 6 months into my treatment for the brain inflammation that I then got out my poetry just to look at, and it just sort of struck me how like it didn't seem that I had written it. It was just so different to anything that I had written before. So yeah, my poetry collection is a bit odd in that way, because I don't think I could write another one like that. Just because it was very much in the moment, and it's very sort of, I do find it quite hard to read now because it just transports me right back to all those feelings that I was just constantly bombarded with and didn't know how to process. So yeah. Yeah, can we talk a bit now about gender and mental health? Because I know we mentioned that a bit at the start when we're doing the introductions. And I do think that like, well, with writing about mental health, it can bring in so many different topics. So Caitlin, your book examines mental health along with several other issues relating to gender and society, as well as grief. So yeah, do you want to talk a bit about the portrayal of womanhood in your book, and then we can sort of like link that back into what we've been saying about different ways that we write and how sort of cathartic writing can be?
Yeah. Well, there are all the stereotypes, of course, of the mad woman in the attic, the going back to the yellow wallpaper, and that's we're aware of that, of how vimen's mental illness and women's hysteria has been viewed as very different from men's. But also what I found in looking at my mother and in my own experiences is the subjectivity, where subjectivity comes in. Because we were raised to question our own authority, to question our own opinions in ways that we were not raised to question men's authority. When we start to experience some kind of disconnect, some kind of schism between reality and our subjective reality, it becomes even more difficult, I think, to be able to untangle those threads. And so part of that is working out where those borders are between the subjective reality and the external reality. Especially for me in a previous relationship where I was straight up gaslighted, so that I had to fight so hard for my for my own perspective, that when I came to a point of having to accept that that my own subjective reality didn't match up with the external reality, I was fighting so hard to hold on to my perspective that I think it made the whole experience that much more difficult. And I think also part of that continuum is an over prescribing of psychoactive medications to women. I don't know if you have statistics on that, but
1 out of 4 women are on
yeah.
psychiatric medications. Yeah.
And for me personally, absolutely, I found that medication quite literally saved my life. And so there is a balance to it's not a straightforward question to medicate or not to medicate. But my mother was so thoroughly over medicated that it killed her in the end. So there's a lot of the book explores the way these things are interwoven into how we understand ourselves as women, and how much we've internalized these gender stories, and how desperately we need to break out of those stories and find something completely new.
Yeah, so like I know, Laura, that your book touches on this too, with sort of the attitudes that medical professionals have towards female patients. And I know with my own experience, doctors were just so keen to prescribe me like antidepressants and antipsychotics as soon as like I presented with these symptoms. And it took me 6 months to actually find out that I had brain inflammation and it was an autoimmune disorder causing it. And yeah, there is very much like this stereotype of the hysterical woman. And like I've had so many doctors assume that because I'm female, any physical problems are also caused by anxiety, and they're just not willing to entertain that there could be something else going on. And yet at the same time, like I do have mental health issues. So it's kind of like once a doctor sees that I've got like OCD and psychosis as a history, that's all that they will look at, and they look at like anything new with me through that lens. And I do think when you start looking at mental illness and gender, it is really fascinating. Yeah, so Laura, how do you think that mental health is linked in with this through your experience?
Well, I think there's a systemic issue. I think there's definitely what we encounter with individual providers, but I think that the issue is bigger than that as well. In my experience, it's lack of training and a lack of regard. It's the very structure of a medical visit. 10 minutes you have to explain a very, very complicated problem, perhaps. And it can be difficult to even articulate what's going on. And then you have this doctor who is, it's not their fault, right? The doctor is, that's what they're given in terms of being able to provide care to you, but it's just not enough time. And so often they're going to make an assumption so that they can get to some sort of a solution for you. Let's say it's a prescription, or maybe it's just deciding that you've got anxiety and that this is not really going on. So I think there's lots and lots of ways that that this can be changed. And I think it really starts with understanding that we cannot that all of our issues maybe need different kinds of structures in the medical profession, maybe even in the behavioral health world, to more understanding different structures sometimes for people to understand, like what Jodie's talking about, this whole holistic approach, and understanding that, well, maybe there's there are other factors here. I know there's functional medicine, for instance, right, takes a very different approach, or I'm imagining, you know, that has something to do with the way that you're practicing, Jodie, to look at the whole person and to make determinations and not just put somebody quickly into a little box and give them bad advice or bad drugs or something. I'm really sorry. I have to sign off because I'm teaching a class 5 minutes ago. Can't wait to continue the conversation with you all. Okay. All right. Sorry.
Bye.
Yeah, is everyone else okay for timing still? Because, yeah.
Good.
I'm okay for another 23 minutes.
Okay, right. Yeah, this discussion just got like really in depth and interesting. I lost track of time completely. Yeah, so Jill, did you want to add anything on sort of like your thoughts of mental illness and gender?
I mean, I do think it. Oh, sorry.
Oh,
go ahead.
I'm sorry. Did you say Jill or Jodie?
No, I heard Jay.
Jodie.
That's all I heard.
Jodie, you can go as well after. So.
Sure, go ahead, Jodie. Oh, me? Okay. Yes, I experienced discrimination, I think, being a woman when I was trying to advocate for my husband, for Don. When he first started showing signs of psychosis on prednisone, and what I could only, he was never actually diagnosed with anything, but I just started doing a lot of research. And I thought, oh my God, you know, he has some kind of mood disorder. He's, you know, violent. He's not sleeping. He's had these weird speech patterns. He's not himself. And I tried to relay that to his doctors, and I was just totally, they just said, well, we'll just decrease the prednisone and he'll be fine. And he was just totally out, you know, he was writing me out of his, as a beneficiary. He was trying to just, I was coping with that, plus the fact that I couldn't get any help for him. And so then gradually he, as unfortunately bipolar progresses, you know, he became depressed. And I just said, you know, I'm going to try to find some help for him myself. You know, the doctors refused, his medical doctors refused to intervene and do really anything. They didn't want to prescribe drugs for him or any psychiatric help. And so I was on my own. And then I ran into, well, we don't take Medicare, or, you know, in my area, there just isn't, you would think it was a fairly sophisticated, highly educated area, but we don't have the resources that they do in the larger cities. And you know, he was gone, you know, by that time. He had become so depressed. And as I was trying to find help for him one day, he just left, and that was the end of that. And then I encountered again when I was trying to even talk to the police and reporting his case that he was missing. It was like, well, it's okay, ma'am. He's probably just out there thinking about something. I said, well, he has a gun. I think, pretty sure he has a shotgun with him. And they were saying, well, he's probably just fine, you know, don't worry. And I just felt like I was brushed off the entire time. And even when I was going through therapy myself, I encountered here, you know, we'll try this drug, we'll try that drug. And they were trying to pigeonhole me into different categories. I had one psychiatrist who was actually a woman say, you know, if women just kept taking hormones, I think, you know, we'd have far fewer of these incidents of depression and anxiety and whatever. So that was my experience basically wrapped up. There's definitely gender issues, you know, just kind of in a nutshell, that's what happened to me.
Okay. Yeah, Jodie, did you want to add on to this discussion about gender and mental health as well?
Oh, I just, I mean, I see it every day. I mean, people come to me, I literally see people come to me and tell me that they just cried in the doctor's office just because one woman, she just went in for a routine check and she just cried because the doctor asked how she was doing, and she had a whole bunch going on in her life and no one had asked her the question. And literally the prescription pad just came out and it was, he's like, here, like, there's no time for that. As so many people said, it's part of it structural, not even, there's just not time to deal with the issues. So it's so much easier to just hand over a pill. And just to be clear, right, sometimes there is a time and place for pills. I'm not saying there's not, but what I'm saying is there's just this reflexive instinct to offer that first without considering anything else, or considering that that's not even what's going on. And even my own self, my own experience with the doctors, even as a doctor and a female, I have a very hard time convincing them that I know my body better than they do, that there really is a problem. And often it just gets dismissed as, whatever. So it's hugely prevalent.
Yeah. I was, sorry, when I entered menopause, my general practitioner said, well, we like to handle that with Prozac.
Oh my gosh. That's terrible.
Yeah.
And she said, it's not good if you're bipolar. And I said, well, my mother was bipolar. That might not be a good idea for me. She said, no, just, you can always go off it.
Menopause is definitely Prozac deficiency.
Yeah.
Yeah, I think like the frustration that we all experience from how we're treated by medical professionals, and like not all medical professionals, of course, but like pretty much everyone does experience this sort of very frustrating time when they're trying to get someone to listen to them. And that's really what's made me realize that like having my experiences written in my poetry collection isn't enough, and I do need to write this memoir because I feel this need to tell my story. But yeah, when I'm writing from my own point of view, it can be even more challenging because it's so personal. And like, although my poetry was from my point of view as well, it's just a bit more distance, and I've like removed myself a bit more just because of the writing form, which is so different. So yeah, I'm just, with my memoir, I'm making myself really vulnerable, and that is quite scary and quite challenging. So has anyone else experienced that as well?
It's terrifying. It's terrifying. Erin talks about writing about things that are in the past so that you've already been able to deal with them and have some distance from them. My book spans childhood to the present. It's just a very narrow focus. I discovered in the writing that the stories that I had been telling were not strictly true. And that was a terrifying thing to uncover in the process of writing.
Yeah, it does sort of give you a lot of sort of moments of discovery, and a lot of it can be quite unpredictable and unexpected as well. And like when it's so personal, the sort of like the unpredictable nature of it can seem like even more sort of worse in a way. So yeah, like of course writing about mental health isn't just limited to memoir. When like I know, Erin, you've written about mental health in many different forms, and one of which is through a short story. So would you say that writing mental health into a fictional plot was as cathartic and important as writing about it in your advice column or in your memoir?
I mean, I think it certainly comes from sort of the same impulse, right? The same impulse to convey an experience to a reader. So this is a good example. I wrote a short story about a woman who is in the depths of grief, like having maybe a psychotic break after losing a baby. And it's a short, very short piece, but it's very heavily focused on what she's going through. And even though there's a lot of sort of like movement in the piece, and it's the story that my agents read, and that's how they found me. And even though that wasn't memoir, it was definitely still like had that sense of my voice, which is also present in my memoir writing. And that's what led me to get my agents, which is how I ended up getting the book deal. So I think that the impulse is from the same place, but the thing that's great about fiction is that you can take sort of your personal experiences with something and then take the narrative wherever you want it to go, right? I mean, you can have sort of endings to stories. You can start at someplace and you can have an ending to it that like you may not know for yourself, but for that character, you may know what their ending is. And I think that in some ways that's almost like a more therapeutic experience than memoir writing, for me at least. And I think it's important that that we are able to write about characters struggling with mental health issues with the same sort of compassion that we would with real life people.
Yeah, definitely. Like I have I write a lot of YA fiction, and I have been sort of working mental health representation a lot more into my newer sort of works in progress. So I have noticed that, and it does allow you, like, although it's very much based on my own experiences still, because I'm still writing about the same illnesses I've experienced, I can sort of access them from different angles and just examine the story from different perspectives, which I am finding like very interesting. And yeah, this links in with the next question, and this is about accurate mental health representation in books. So why is it important for readers who have mental illness to be able to see themselves in books, both fiction and non-fiction? Now, Jodie, I'm going to come to you first because of your job. So having accurate representation of mental health in books must be really important to you, I'd imagine, and it must be so infuriating to see harmful representations or where mental illness is used as plot devices.
Yeah, for just the reasons many of you have talked about, right? It's stigmatizing, and right, so then you're afraid to reach out because it feels, you don't want to feel like that's you, right? And it's so twisted sometimes in the way it's talked, but I think memoirs have a particular, well, both fiction and memoirs, right? They're so, and poetry too, right? But just that to feel the experience from the inside out, and for others to realize they're not alone in the experience, I think is what's perhaps most valuable, and to realize because it has an ending and people have already lived through it, that you can get through it and you can come out the other side. So I think it's so important that way. But yeah, when you, like you said, when you just use a psychotic experience, for example, as a plot twist, or to become the evil character, it's so damaging to the ability for people to reach out for help.
Madeline, I have something to add to that. As you guys were talking, I just had an epiphany too, because and I think I knew this about myself, but I started out as a 19th century literary scholar, and I actually started like in my early 20s, studying Coleridge, who loved, I mean, he had psychotic episodes and tried to treat it with opium, obviously. And then William Blake is one of my big poets who obviously had psychotic. I mean, he saw the ghost of the flea, right? He had all these visitations, the Shelleys, all of these figures from the 19th century, like you mentioned, Caitlin, the Mad Woman in the Attic, and Charlotte Perkins Gilman, and even Virginia Woolf. So I had just early on, even before I really started to struggle with depression, I had these representations of my own mood disorders as being a place of creativity. Like that was the stereotype that I went into my my struggles with. That yes, it was very difficult. There were times when I couldn't get out of bed, and therapy and everything, but I sort of held on to this illusion that this was where creativity sprung from, these altered mind states, and that I did not want to medicate for it because I wanted to have access to that, even though it was so painful. Writing the memoir, like I only came to creative writing like in the last 10 years of my life. I actually had to come to terms with how painful that dealing with mental illness is. Like it's not just this creative fountain. It's extremely painful, and I'd always seen my grandmother's mental illness as maybe this thing that I inherited, this creative source that I inherited. But in fact, I think that she suffered in tremendous ways. And so in writing about her, I had to come to terms with the pain of it, and not the idealization, the romanticism of it. So yeah, that was just another perspective on representations of mental illness in literature.
Yeah, that's really like I relate to that a lot, because I remember when I was first prescribed the antidepressants for my OCD, I was really hesitant about starting them because I just thought it was gonna like shut off my creativity, and I just had like this view of it that you couldn't be creative and on antidepressants at the same time, which I then found wasn't true at all, because like I had to start taking them for my own like mental health, and I found I was still able to write, and because I felt a lot calmer on them, and I was able to enjoy my writing before more than I had done before, because before it was just like I'd be writing in these like frenzied bursts, and I just like feel so stressed by it and feel that what I was writing wasn't good enough. But once I was on the antidepressants, I was still able to be creative. And I remember I actually wrote a personal essay about that, just because it was just this huge fear that I'd had about taking the antidepressants, thinking it would shut off my creativity. And I just felt that I needed to write this, because I remember like a couple of readers got in touch with me to say that they were really glad that I'd written about it, because that was one of their fears too. And I think that fear is like, well, it's pretty much a stereotype, and it is very prevalent in society. Yeah, so which other books do we think portray mental health well and accurately? Because we've already talked quite a lot about specific texts, so are there any others that like you'd recommend? Sue, do you want to answer it?
Yeah, one memoir that I think is just brilliant and is I Wore the Ocean in the Shape of a Girl by Kelly Groom. She is also a poet, and the memoir is just, it's beautifully written, and it's so emotionally authentic. And it's one of the best memoirs I've read probably in the last maybe 10 years. So it's I Wore the Ocean in the Shape of a Girl by Kelly Groom. That's probably one that I would recommend. Also, Autobiography of a Face by Lucy Greeley, which probably more people have read. Yeah, DJ is. Yeah, but those two I think are really, because they're both beautifully written and profound.
Mm-hmm. Yeah, like I've been thinking about this from a YA fiction perspective, because like in the last few years especially, you are seeing a lot of more like own voices, mental health representation in fiction, which like I absolutely love. And Holly Bourne's books especially are so good for mental health representation. I don't know if any of you have read her book Are We Normal Yet? But it's got like amazing OCD representation in it. And like what I really like about it is that it's not used as a plot device, and it's not used as the character's only sort of like main characteristic. She's got like this whole personality as well. And a lot of the time when I see these fictional characters, especially if it's like a minor character, but sometimes the author will make it where the mental illness is sort of like the only defining characteristic that that character has. And I just think we need to like really concentrate on opening it up a bit more and showing that mental health isn't like what the only thing that would define someone. So yeah, I'm just sort of like reading loads of YA fiction at the moment, like searching for these ones with like really good mental health representation. And like Maureen Johnson as well, in her book Truly Devious, the main character has an anxiety disorder, and it's just like it's mentioned a few times and you can like see it in the main character's actions, but like the book isn't about having an anxiety disorder, because it's a murder mystery, the book. So it shows that like even if you are mentally ill, you're still able to do like great things and like lead exciting lives. So I think that's really important. Yeah, so Elizabeth, did you have anything you wanted to add to sort of like
did. I have a little bit of a list. So if anybody wants to email me, I'd be happy to send it around or add it to the chat afterwards. A couple of the books that keep coming up in my mind have already come up in the discussion, like The Yellow Wallpaper is a great one. And I think when we did our Twitter panel, a couple of people mentioned Bessel van der Kolk's book, The Body Keeps the Score, which I just think is such an important book and amazing that it made it to the New York Times bestseller list. It's a book about trauma and how PTSD is experienced in the body and how you need to go through the body to treat it. I'll quickly list off a couple of others, and then there are just 2 or 3 that I want to say a little bit about, but these are kind of classics, but I think they do really hold up. William Styron's Darkness Visible, Elizabeth Wurtzel's Prozac Nation, Susanna Kayson's Girl Interrupted. This is pretty old school and I haven't read it for a long time, but I'd be curious to see how it holds up. I Never Promised You a Rose Garden, which probably a lot of us read when we were 12 or so, by Anonymous. And of course, The Bell Jar by Sylvia Plath. But here are just 3 books that I wanted to mention because they're a little bit different as far as their scope. One is just one of my favorite all-time books by Mira Bartok, The Memory Palace. And for me, that was just so important because it deals with a family. And so it's about a schizophrenic mother and her 2 daughters and what her 2 daughters have to go through their whole life in order to sort of survive life with a schizophrenic mother. And then a book that I read for my book was Siddhartha Mukherjee's The Gene. And it's not about mental illness, but it has a great chapter on epigenetics. And it's the best thing that I've read that kind of explains how this very sort of scientific idea can translate into a more maybe literary idea of how we carry on our ancestors' guilt and experiences, traumas. And then the last one, this is a little bit off topic, but Eric Kandel has a beautiful memoir called In Search of Memory, and he's a famous scientist. And it's the only book that I was able to find that talks about the link between depression, mental illness, and memory disorders. So in my case, I was always sort of looking for a link. You know, it didn't seem surprising when my mother came down with dementia and memory disorders. Of course, there are so many potential causes and physical factors, but I really wanted to know, was there any psychological component at all? And it was a little bit taboo to ask that question. So I did a lot of research. I talked to people about it and everybody just said, no way, no, because that's sort of blaming the victim, which I understand. But I think that the way that Eric Kandel presents this is we have a responsibility to take care of our memories, or not a responsibility, but we are very lucky if we can. And treating mental health is one way to at least do what we can for our memories in the future. So again, not to blame the victims at all, because also we're at a different cultural moment where we can see this, but just the importance in our, kind of current moment of looking after your mental health.
Yeah, so what really struck me then when you were speaking was about like how much of memoir writing is about research and like looking for links and just sort of like finding out more information. To say if we've got a writer who wants to write about mental health in their books but does not have any experience of like the mental illness themselves, and say if it's a novel that they're working on and they want to know where to start with this research and how to get an accurate representation, like where would they start? Like what would we advise them to do? So like Jodie, what would you suggest like this person goes to for their research? Like what part would they start with?
I would think if they hadn't experienced a memoir, it was the place to start the research, right? To really understand, again, from the inside out, and to really understand connections and how putting it in context of the environment and the situation and the psychogeography, again, I just love that word, right? But the whole picture and that thread that happens in both in fiction too, right? How important that thread is in terms of making context. So it's not just a 2-dimensional character that happens to have, as a plot twist, but rather the whole context of the life makes sense within their upbringing and what the events that have happened to them and the way they live their lives and the way they think about their lives and the way they think about themselves and the way they think about the world around them and the way they tell that story. So.
Yeah, definitely. Erin, are you still okay for time?
I was just going to pop in when I could. I actually have to go because it's after, it's past the half hour. So thank you so much for having me. It was really great chatting with everybody, and I'll see you soon.
Are we good? Bye. Bye, Erin.
Bye, Erin. I actually have to go too.
Yeah, I have to go as well.
Maddie.
Well, we can wrap up here now. So yeah, should we wrap up? Because we've covered like most of the sort of like important parts of mental health and like the different ways that it can be written, like in memoir and all the different forms. Has anyone got any sort of final words they'd like to say before we leave?
Yes, my only final word is that if you are thinking about writing a memoir, just to be fearless, to really not be afraid to go into those dark places, and to learn that sometimes you just have to sit with it. And if you don't tell your truth, nobody will. And everybody's truth is really important. And everybody has a story, and I think everybody's voice is important. And our job as writers is not to make people feel comfortable. Our job as writers is sort of to shake up the status quo. So just, believe in your story and write your story. And if you are scared, just know that the really bad thing that happened to you, you've already survived that. That happened in the past. Now, you get, it's sort of your chance to have the last word and to convey your story with your own truth to it. So just, pep talk, go for it.
Great. Okay. Yeah. So yeah, we need to be fearless with this. So thank you. Oh, yeah,
I just to add on to that about story, I think this kind of fits. That I think DJ was talking about the familial lineage, and that we somehow inherit these things. And one of the things that I really learned in writing my memoir and wanted to communicate was that if we take this epigenetic proposition, understanding those roots to familial trauma are the path toward ending it. And so it's our story. And the beauty of writing a memoir is that you see that this is your perspective on these events, and that these inherited stories aren't your story, and you can choose to tell the story the way you want to. So I think that even if we don't write our memoirs as therapy, there's a tremendous path to healing through conceiving of our stories and claiming them as our own, and moving forward with our telling the story the way that will help us live our lives.
Yeah, definitely.
I had this epigeneticist person tell me that if you feel the story is sitting on your shoulders, if you feel the need to tell the story, you probably are the one who is chosen to do that healing, not just for the family, generations into the past and future, but also to give voice to that story that can help other people, because that's what memoir does. It helps people who maybe can't articulate it or don't want to or don't need to. We give voice to that. So we're healers in a way, even if that's not what we want to be.
Yeah, like it is empowering writing about mental health and claiming what's happened to us and just like taking ownership of it. So thank you everyone for joining me.
Thank you for organizing all of this.
Yeah, thank you, Madeline.
Thank you, everyone. This was great.
Yeah, we have I don't know if you guys can see, but we have a lot of great comments on the list that I'll post. And if you could all send me links to where people can order your book, I will put that in the comments, and this will just stay as a recording that people can watch. So
thank you.
And thank you, DJ.
Thank you. Thanks, everyone.
Bye, everyone.
Bye.
Bye.